I've suffered with back pain for about 5 years. It's been persistent. It affected my life as far as I couldn't do much. I couldn't keep up with people. I couldn't sit still because I would be in pain. I'd have to get up, I'd have to sit back down. My life revolved around the pain. That's how I dealt with it. It really was tough. I got into my primary care doctor and kind of got juggled around with an orthopedic surgeon. I seen a couple different doctors and I felt like I was kind of getting juggled around. I went to a pain clinic to treat my back. They had tried numerous things and still wasn't as effective as far as injections go on physical therapy. So they referred me, they said about Inspired Spine Clinic. So I came to Inspired Spine Clinic and to treat my back. What I was missing out on was my hobbies, such as walking in nature, being social, missing out on just a quality of life and being comfortable. It basically isolated me because I couldn't do much. I didn't want people to be bothered with me saying, oh, I'm hurting, that kind of thing. So my pain would get up to a 9. I had sciatica with the back pain that would shoot down my leg and into my foot, literally almost making me fall sometimes. So my pain level now, and it was like a 9 before, literally for 3 years, it wouldn't go below 6 on a pain scale. Now, the pain actually today is only a 3. It exists just a little bit, but it don't cause any dysfunction or anything in my life with the pain. I'm able to manage it now. I'm finding myself not complaining about it because it's not there, and it's kind of something to get used to because I was used to being in pain all the time and no one wants to be in pain. But I realized, well, it got a lot better. Today my pain is a 3 or 4. So I experienced a lot of depression. I already have depression, and I realized that, hey, the depression makes the pain worse, the pain makes the depression worse. And so my surgery approximately was like a year and 2 months ago. I had 2 procedures by Dr. Abbasi. I had an SI joint procedure, which is on the side, and I had a fusions done on the lower back, L4, L5, and they were 2 separate procedures. The first procedure, I was in the hospital. I spent the night. Next morning, almost immediately after a couple hours, after I woke up and seen the nurse and docs, I got to go home. I walked with a walker. I didn't expect that I was going to be moving around that quick. It surprised me because I've heard people say they're in the hospital for days, and all that stuff. So I was grateful I got to go home the next day. On the second procedure, the SI joint procedure, I stayed at a surgical center where you can go home the same day. Dr. Abbasi of Inspired Spine did my surgery there in Maple Grove, and after I woke up in recovery, I believe it was about an hour and a half, I actually got up and walked down the hall with a walker and back. I could not believe I was walking that quick right after. I also went home after that. Yep. Back to walking, fast-paced walking. I can go up and down stairs now. I can lift stuff. Yeah, I'm definitely a little more physically active with things now. So I would consider it because, yes, there's a rehabilitation part in it, but the rehabilitation part after the surgical procedures like the bullet, it's definitely less recovery time, and you'd be amazed how quick you make progress really fast with it. And it's not that bad. It's really not that bad after the surgery to recover. I was amazed by Dr. Abbasi, how friendly he was, how he knows a lot about what he's doing, that he actually said you can go home on one of my procedures the same day, when I was guessing I'd probably have to stay overnight. It was amazing, so very good, very good. So if you live with someone and they're not able to help you that much, this is actually a good thing, because The rehabilitation, you can move around still with it, slowly but surely. Still today, now it's been a year and 2 months since my surgery. Just found out that everything looks great, and the bones are getting really good around the fusion, and that there's no problems. And that actually Dr. Abbasi said, unless there's any complications, I do not have to come back. So I will just continue getting treated by the pain clinic with the pain stimulator, and my quality of life has improved. I'm not always thinking about the pain.